Hello, this is Dr. David Green, CEO of the Florida Pain Network. Today's topic is what are the best treatment options for spinal stenosis? Spinal stenosis involves a narrowing of the spinal canal with pinching of nerve roots as a result. It's usually due to bony and soft tissue overgrowth from arthritis. It usually occurs in patients who are over the age of 50, and it's usually seen at multiple levels, and it's not symmetric between right and left. Here you're looking at a spine from the side. You can see some bone from degeneration going back into the spinal canal and forward from the back there, so you can see how it pinches it. Here's a cross section. Here's a normal spinal canal, kind of elliptical, but then when you start getting overgrowth in these joints in the back of the spine and then some hard disc from degeneration, you can see how it starts getting pinched. The symptoms of spinal stenosis typically include aching, pain in the buttocks or legs on the affected side. You may have symptoms of sciatica if a nerve root is getting significantly pinched. In unusual cases, you may get leg weakness, and it may be mistaken for a hip joint problem if the pain wraps around into the groin. Typically, it's position related. Leaning forward feels better as it frees up the nerve roots. It kind of opens up the canal. There's a distinction between neurogenic claudication, which is from spinal stenosis, versus vascular claudication, which is from arteriosclerosis. In reality, most people with spinal stenosis have no symptoms whatsoever. All right, but let me just distinguish. So neurogenic claudication is usually position related. Vascular claudication, when someone starts walking, they start to have significant pain in their calves after 30 feet, 50 feet, whatever the typical distance may be. That's not how it's not how neurogenic claudication occurs. That's usually from the buttock and thigh area down, and it usually occurs due to position. Vascular claudication, like I said, is from the calf up usually, and it's distance related. Treatment options for spinal stenosis may include over-the-counter anti-inflammatories and Tylenol, opiates for short-term exacerbation periods. Neurontin and Lyrica can be great. That's been shown in a study out of spine. Physical therapy can help. Spinal decompression therapy is intermittent spinal traction. That can be beneficial for months at a time. Epidural steroid injections, the most common is what you see here, a caudal epidural where the needle goes in below the level of the lumbar spine. The fluid migrates up and can relieve pain in multiple areas. Whether or not to have surgery for spinal stenosis is a quality of life decision. You don't have to do it. Nobody ever died from spinal stenosis. The decision should only be made after considerable conservative treatments fail. Probably less than 10% of those with spinal stenosis end up needing surgery, which would be a lumbar laminectomy. Here you see a lumbar laminectomy. This is actually a full laminectomy where the bone is taken off, over the spinal cord. It's not really the spinal cord anymore, but for all intents and purposes, we'll call it that. See these nerve roots coming off? That's what you're freeing up there, okay? Now, if you just have symptoms on one side, you can leave the bone on one side and just do a hemilaminectomy. The procedure takes about an hour. Usually you don't need a fusion. It's low risk. Half of patients do end up with some low back stiffness afterwards. And you can also get some scar tissue around the nerve roots that are freed up. That's called post-laminectomy syndrome. So usually it's effective, but sometimes there are some issues. The bottom line with spinal stenosis is that surgery can be avoided over 90% of the time. Epidural injections can be repeated every few months. Those are the gold standard for treatment. It's a quality of life decision to whether or not to have surgery. And if someone does add a spinal fusion to it, it does add a whole level of complexity to the procedure. The top non-operative pain management in Florida is through the Florida Pain Network. There are many clinics participating throughout the state, accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online for treatment in the Tampa area at painmanagementtampa.com, and then call us for more information and scheduling. 813-666-4399. I'm Dr. David Green with the Florida Pain Network. Your pain stops here.